Welcome to The Explainer. Okay, so let's dive right into the world of natural remedies during pregnancy. It's a topic that comes with so much advice from everyone, right? But figuring out what's actually safe and what works can be, well, a little confusing. We're going to break down what the evidence says is safe, what's effective, and what you really need to steer clear of. If there is one thing you remember from this entire explainer, please let it be this. The word natural just feels so good and comforting, doesn't it? But it's not a synonym for safe, especially not when you're pregnant. And this slide just lays it out perfectly. I mean, think about it. Arsenic is a completely natural element found in the Earth's crust, and it's a deadly poison. On the other hand, you have ginger. It's a natural root, and it's one of the best things you can take for morning sickness. Worlds apart, but both are natural. All right, let's get into our first section, soothing those common discomforts. We're going to start with two of the biggest culprits out there, nausea and colds. For that, all too common morning sickness, you actually have several really solid, evidence-based options. Ginger is fantastic for calming down those nausea signals in your brain. Peppermint can help relax your digestive muscles, and vitamin B6, it's so well studied that it's often the very first thing your doctor will recommend. Now, this one is really interesting. This is a super simple but powerful trick that hospitals use all the time. When you sniff an alcohol swab, that really potent smell sends such a strong, fast signal up to your brain that it can literally hit a reset button on your nausea response. It's wild. Acupressure is another great option that's been studied a lot. The key, of course, is finding the right spot. It's called the P6 point. Just follow these steps on your inner wrist. Find that little sweet spot right between the two tendons and just apply some good, firm, steady pressure. It can make a huge difference. Ugh, getting a cold while pregnant is the worst, right? All of a sudden, that cold and flu aisle at the pharmacy just looks like a minefield of things you can't take. But these simple remedies are totally safe, and they really do work. A little bit of honey can soothe your throat, and gargling with warm salt water helps bring down that inflammation. Okay, next up, section 2 is all about aches, pains, and digestion. Let's get into the wonderful world of heartburn, headaches, and other fun stuff. Let's be real, constipation is incredibly common during pregnancy. You can thank those pregnancy hormones and the iron in your prenatal vitamins, but you should never underestimate the power of prune juice. It's like a perfect two-part system. The natural sugars pull water in, and the fiber adds bulk. Together, they really get things moving again. Now, when it comes to preventing UTIs, you've probably heard drink cranberry juice, but the real power of the cranberry comes from a compound called PAX. And what they do is make it harder for bacteria to actually stick to your bladder wall. So while juice can help a little, a capsule with a standardized dose of 36 milligrams of PAX is a much, much more reliable way to get that protective benefit. Ah, heartburn, that fiery feeling. Different remedies work in different ways. Calcium carbonate, which is what's in a lot of antacids, is a fantastic first choice because it just directly neutralizes the acid. Now here's the big aha moment on this slide. Milk, it might feel good for a minute, but the fat and protein can actually trigger your stomach to make more acid later on. You get this rebound effect that can make it even worse. Headaches can pop up for all sorts of reasons. Hormones, dehydration, you name it. But before you reach for any medication, these simple strategies can be surprisingly effective. Staying hydrated is absolutely number one, and a cold compress on your forehead or a little bit of diluted peppermint oil on your temples can give you this cooling sensation that really eases the tension. So what happens if a toothache hits you at 2 in the morning? Clove oil can be a total lifesaver. It contains a natural numbing agent. Now the key here is to use a tiny diluted amount on a cotton swab right on the spot. And it is so important that you do not swallow it. This is just a bridge to get you to your dentist. It's not a cure. Okay, let's switch gears to something really critical. Knowing what helps is only half the battle. This next section is all about what you absolutely must avoid, and this is information you definitely need to have. You have to be so careful with certain herbs, even the ones that are marketed for things like hormone balance. The ones you see here, like black cohosh and Don Quai, they contain compounds that can actually stimulate uterine contractions or mess with the hormones that are essential for keeping a pregnancy healthy. This is such a critical distinction. Putting a few drops of lavender oil in a diffuser is one thing. Swallowing that oil is something else entirely and can be really harmful. The concentration is just too high and can be toxic. So ingesting essential oils during pregnancy is a hard no. You know the saying, more is not better? Well, that is definitely true for vitamins during pregnancy. This is not the time to experiment with mega doses. In fact, huge amounts of certain vitamins, especially vitamin A, can be harmful to a developing baby. Your prenatal vitamin is carefully formulated with exactly what you need in safe amounts. Just stick with that. And that brings us to the most important takeaway from this entire explainer. Seriously, if you only remember one thing, please let it be this. This is the golden rule. It doesn't matter if it's an herb, a tea, a supplement, an oil, whatever. If you are not 100% sure, the right move is always, always to just pause and ask your doctor or midwife. They are your ultimate safety net. Thinking about this ahead of time is so empowering. It helps you walk into your next appointment feeling confident, ready to have an informed conversation with your provider. And that makes sure that every choice you make is the safest and the best one for both you and your baby.